Hi, I'm Patricia Greenberg, the Fitness Gourmet. Welcome to Eat Well, Live Well, Age Well, where we discuss all things about aging well. Today, my guest is Lorena Drago. She is a registered dietitian, consultant, and a certified diabetes care and education specialist. Lorena is a godsend when it comes to diabetes. She knows everything there is to know about it, from onset to care to wellness and prevention. She really loves, I've known Lorena a long time, very long time, full disclosure. We went to college together. So we were in our late teens, early 20s when we met. But she really likes to work with people in the multicultural aspects of diabetes, self-management, and education. I'm going to give her a second to tell us a little bit more about what she does before we start the questions. Welcome, Lorena.
Hello. Thank you so much. Hello, Patricia. So nice to be chatting again, and especially talking about my favorite topic of all times, which is diabetes. And I think that in a nutshell, what I would describe myself is as someone who helps persons with diabetes manage the condition with practical and actionable information. I am also an author, and I have a private practice right now with all this that's happening. I was very happy to be able to open the online space. So then this way, all my consultations are virtual. And in many ways, it helps people because they can run to the kitchen and they can say, what about this? What
Yeah,
about this
yeah,
brand?
yes.
So it's always very useful. And I
Very hands-on.
also
That's great.
very hands-on.
Mhm.
Talk about practical, right?
Right.
And also I am a speaker, and I work with many dietitians as well as diabetes educators, providing them with cultural competency training. So that's one area that I am very passionate about.
So we're going to get into the real nitty gritty of it, but quickly, how did you come to specialize in diabetes?
It was very interesting. When I started having a lot of patients who had diabetes, and I knew that there were many people who were diabetes educators specialists. And I said, this is an area of interest because the cornerstone of diabetes management was lifestyle, right? And I felt that I could really work well with the population. So then I started gathering all these teaching tools, but I always wanted to transmit information that was actionable, kind of like a storytelling of this is what happens when you go to the supermarket. This is what happens when you go to a party. So I wanted to bring it that real life, not the best, but what do you do? And sometimes it's not the best, it's just
Right.
whatever best is in that situation. So little by little, I just became fascinated with the topic. And also, I had many patients who were Spanish speaking, and that is a population, Hispanics and other groups have a higher prevalence of type 2 diabetes. So then I just felt that it was just the right information for the right people, and then everything just started. It was like a little fire, then
Yes.
later on it just became this huge, ever consuming in a very good way.
Well, you're doing such good work, and I know it's hard work, and I know it's been many years of hard work. So I commend you and congratulate you. Now let's talk
Thank you.
about the basics. First of all, what is diabetes?
So diabetes is a condition in which the cells of the pancreas that produce insulin are not working efficiently. Because of that reason, then blood sugar levels become elevated, higher than the recommended range, and then a person develops diabetes. So it could happen because the insulin that our bodies are producing are not working adequately. That's something that you probably have heard, and many people called insulin resistance. And the way that I like to describe it is, imagine if the insulin was a key, and then now you are putting that key into the lock and it's just not working well. If it's not working well, then that door doesn't open. So then all that sugar stays in the bloodstream and it raises the blood sugar. And then the other piece would be that the cells of the pancreas stop producing insulin. And insulin is necessary, it's the hormone that is necessary to kind of gather all that glucose or blood sugar into our cells and just keep them there as we need them. When insulin is not present, then that's also diabetes.
Couple of questions I had. I know, having trained as a dietitian myself, we traditionally had type 1 and type 2. And type 1 is you were born with the inability to either produce insulin or your insulin was insufficient. Type 2 was believed more to be lifestyle related, almost something that you did to yourself. Can you kind of clarify all that for us?
Right,
Now I'm hearing there's
sure.
1.5.
Yes,
Yeah.
correct,
Yes.
correct.
Uh-huh.
So then let me just go back to all the definitions. So type 1 diabetes is when your body stops producing insulin. Um, Pretty much there's no insulin, and that can happen at any age. It could be at age 2, at age 1, at 10 years. So it's usually, I'm going to say, associated with younger individuals. Type 2 diabetes is a combination of there's insulin resistance, and then there might be um, the death of those beta cells, the ones that produce insulin. And then we have gestational diabetes, which is diabetes that occurs during pregnancy, and it usually resolves once the woman gives birth. And then we also have LADA, which is an acronym, which is LADA, which is latent autoimmune disease in adults. So then LADA is, most people may think, or it's diagnosed as type 2 because it usually happens during adulthood, but it's really a version of type 1, but it develops very slowly. So eventually, individuals will have no insulin production. And then the only way to be able to manage their blood glucose levels is through insulin. So type 2, 90% of individuals have type 2. About 10% may have LADA. Another 10% may have type 1 diabetes. What I like to say is that regardless of diabetes, the person hasn't failed, their pancreas failed. There are certain risks that are associated with developing type 2 diabetes, whether it's genetic, environment, etc. But truly, your pancreas has failed to do something that it was supposed to do. So the key for everyone who has diabetes, no matter what type, no matter what age, is learning how to manage your diabetes so that you can have blood sugar levels as close to a person without diabetes and live as healthfully as possible.
That's fantastic to know. So, we talked a little bit about the types, and there's some, I guess, known causes and unknown causes. I know there's these anomalies where people just kind of get it out of nowhere, very healthy, fit people, or people who eat sugar breakfast, lunch, and dinner and adhere to no lifestyle choices that are healthy and never get it. So I'm not saying it's a full crapshoot, but I know these things happen. So the myths and the realities of it are, is there really such thing as a prevention? Can you prevent diabetes?
So, Patricia, this is a fascinating study that has been replicated many times all over the world. So it really encompasses different individuals from ethnicities, races, etc. And that was the DPP, the Diabetes Prevention Program. So there is a terminology called pre-diabetes. So to define it a little clearer is when your blood sugar levels are high, but they are not high enough to be diagnosed as diabetes.
Yep.
So if I am using the numbers, the ranges, if your blood sugar is 125 fasting, 125 or higher, and it's done twice, you will be diagnosed with diabetes. But then what happens if it's between 100 and 124? So it's high, but it has not crossed over to that 125 mark and higher. So what this study wanted to do was try and see, they divided the group into 3 arms. One group received nutrition counseling, frequent nutrition counseling, per week, every week for 16 weeks. And what they were told to do was make modifications in the foods that they ate. And they were asked to count fat calories. So they were asked to diminish the amount of fats that they were consuming and to engage in physical activity 5 days per week, 30 minutes. We are not talking about a marathon like you probably are very familiar with. We are not talking about dancing for 3 hours or swimming 30 minutes, and most people walked. Something that we can all do, 30 minutes of walking. And then there was another group that was given metformin, which is a very popular drug that is given for people who already have diabetes. And then the third group was just given advice, handouts about healthy lifestyles, tips. So what happened at the end of this study? 58% of the people who received no medication, 58, their blood sugar levels reverted back to the normal range.
Amazing.
Amazing. So we are talking about having, and compared to 38% of individuals that received metformin. So when I tell my patients 58% versus 38%, your medication is in your closet.
Right.
And it's called sneakers.
Right.
And it's called devoting yourself 30 minutes a day to walk. And the other medication is in your kitchen. And what that means is I am going to be mindful about the choices of food that I select most days of the week. Now, some individuals lost weight, but guess what? They lost 5 to 10% of their initial body weight before starting the study. What are we talking about? Someone who is 200 pounds, we're talking about 20 pounds. We're not talking about losing 80 pounds.
Right. It's not an insurmountable amount of weight. It's
exactly,
a very achievable goal.
Exactly. And not only that, but it was the changes in the choices that they were making, which I think that this is a message that I really want to underscore, is that most people think this insurmountable amounts of changes in the food. And we're talking about what I like to call the P's and Q's. Portion and quality, improving the quality of the foods that you eat within reasonable portions. And so when I shared that study, again, that has been replicated all over the world, that is when people say, oh my goodness. And I said, yes, no side effects, because when you put your sneakers on, when you choose better food choices, you don't have any side effects to worry about. And guess what? It's free. You don't have to worry about co-payments. Right. You don't have to worry about any of that. So to answer your question is, if you are at that pre-diabetes danger zone, the most important thing that you can do is, first of all, find out if you are.
Right.
Ask your doctor, what was my blood glucose or blood sugar level? Is that within the normal range, or is that a little high? You don't know, Patricia, how many times I have seen patients, and when I look at their charts, I have seen that they were at the pre-diabetes range 2 years before, and no one had told them anything.
That's
So then
astounding to
what
me.
happens is
Yes,
they are being referred to me because
yes,
now they have been
right,
diagnosed,
right.
and maybe there would have been something. And again, 58%, it's a great odd. You know, if
Yeah,
you have
yes,
to,
yes,
it's
yes,
great odds that
absolutely.
you could have done something to minimize or to delay. In many cases, delay, in many cases, but at least you had that choice.
You know, that it's astounding to me, and I also recommend to people when they go to the doctor, said I have high blood pressure, and I say, what's your number? And they, I don't know, he just said I have high
Correct.
blood pressure and my
Correct.
sugars were good. Well, what was your number? I don't know, he just said I wasn't diabetic yet.
Right.
And I think
Right.
to myself, where's the doctor in this and where's the patient in this? Everybody's got to pay
Yeah.
attention and ask. So it's really terrific advice. I wanted to talk to you, and you're covering this without my even ask. A level of fitness obviously was one of my first questions. Foods, particular items in food, like we talk a lot about alcohol consumption.
Mhm.
Certainly, we know soda, candy, cake, cookies, etc.
So
Um,
I'm going to divide that
yes. Okay.
so that people can have a clearer idea of how those food, what role do they play. I think that one of the things that I usually say, if you are doing something continuously, that's basically what you need to think about in terms, instead of just eat this, not that, eat this, not that.
Mhm.
But I like to look at the continuum of the things that we do most often. So when it comes to sodas, sweetened beverages, and I would put all of those things, sweetened beverages, there's really nothing that's good about them. Okay. So if I would say that if there's one food item that I would probably discourage, would be sweetened beverages.
Okay.
Again, not to say if one day you're going to have a glass of a sweetened beverage and it's going to be a do or die situation, but it's not something that you should have at home. It's not something that should be a, a part of your life. With, again, rarely, if something happens and one day you really want to have it, it's not a big deal. Now when it comes to other foods like cookies and cakes, um, ice cream and all those dessert type of things, we all know that we don't eat those foods for their high nutrient content. We eat them because they taste good, and many times they're part of a celebration. Uh, but to be mindful, simply because if you already have diabetes, those foods will give you a spike on in your blood sugar levels. So again, just to be mindful, not to be obsessed with it, but to be very mindful of what it does to your blood sugar levels. And for those individuals that may have pre-diabetes, so that means that they are at risk of developing diabetes, I would say the same thing as someone with diabetes. Just be mindful,
Right.
not obsessed, but mindful, very mindful.
Tell me your thoughts on alcohol consumption. I bet that's a better way to phrase it.
Yeah. So I'm going to the American Diabetes Association, their dietary recommendations recommend that if you're going to have an alcoholic beverage and you're a woman, no more than one serving. And one serving is equivalent to 12 ounces of beer, 4 to 5 ounces of wine, and 1.5 ounces of any other liquor. Now, many times those liquors come combined with in a cocktail form. So I always had a joke, and this is from one of my mentors who passed away, and she used to say, if your drink has a little umbrella or a decoration, be mindful,
Yeah.
because you know your blood sugar level is going to become elevated in about 15 minutes or so. So yes, that is something to be mindful of. If you're just going to have one beer, if you're going to have one glass of alcohol, of wine, I would say that would be fine. The only thing to consider is, so one serving for women, 2 servings for men. Of course, if your doctor has told you that it's better for you to stay away from alcohol, then just follow your doctor's recommendations. Be mindful with certain medications that may not be as effective when you're drinking. So one beverage may elevate your blood sugars a bit, but the good news is that alcohol is digested as a fat, not as sugar, as a carbohydrate in many cases. And drinking too many servings of alcohol can give you a low blood sugar.
Oh,
So
really?
the
Oh,
reason that I say that is the good news is because when I tell patients this, they start thinking, oh my God, this is great. As long as I don't have a cocktail, so then I can have vodka by itself, I can have whiskey by itself or bourbon. And the reason is that because it is a fat and the liver is involved in detoxifying our bodies from the alcohol, then that means that the liver cells store glucose, which is blood sugar, so they cannot free some of that glucose, and it can cause a low blood sugar. So I would say, once again, see how alcohol works in your body.
yes.
And the only way to know this is testing. And when you test, you can see what's going on in the body.
I have the unfortunate or fortunate situation where I'm drunk as a skunk by the second glass, so I'm good on my one. Um,
Right. You would be
yeah,
following the guidelines by default.
that's exactly right. My body won't allow me to go further. So let's talk a little bit also about the level of fitness. I love your idea, and that is something I've adapted to in the pandemic, and many people here. I'm so pleased in my neighborhood is I see my neighbors walking all the time. You know, the one way we won't feel trapped is to get out and walk 30 minutes, 60 minutes. But what does, just as a little aside, what does excessive fitness do? Because I'm a recovering marathon runner, and I say that kind of in jest, but I do feel a lot better now that I'm not running 26 miles and I'm just doing,
Wow.
3 to 5 miles. So,
Well, yeah.
yeah.
Well, that's interesting. So most of my patients are not at your level of engagement.
Mhm.
Most individuals have a difficult time engaging in exercise. So I would say that you are perhaps not as common as the average person,
Right.
right? I think that most people just need to move more.
Okay, my
And
question is more, that's for sure. My question is more as people who take on extreme athletics or
okay,
you can
so
overdo exercise,
right. So
I
for
guess is what I'm asking. So what is
oh,
the repercussions of
absolutely.
that
Yes,
on
absolutely. I think definitely that you can. But for example, I have had some individuals that have participated in sports, and what they do is for those who use insulin, what they have to do is just to make sure that they're using the right amount of insulin and that they are hydrating as well as eating adequately to ensure that their blood sugar levels, they don't have hypoglycemic episodes or hyperglycemic episodes. With individuals that are not using insulin, but maybe using some medications that can tend to lower their blood glucose levels, that would be some of the key issues that I would underscore is to make sure that they have identification if they're out there running or biking, etc. That they keep with themselves fast-acting glucose, whether it's in a gel form, beverage, or glucose tablets, and that they have their meters with them or their sensors. If they're using continuous glucose monitoring, they can actually track and see whether they are increasing or decreasing. In many cases, I had one patient who was a type 2, and he discovered that the more he exercised, the more he was able to manage his blood glucose.
Mhm, mhm.
So exercise became his the way to manage his
Right.
blood glucose. So he exercised in the morning, he exercised during lunchtime, he exercised during the evening. Now, as long as that doesn't interfere with their other activities, I would say you're fine. And if you feel fine, then I would say yes, go. But I have never been one to do anything that's extreme. So
Right.
I always try to bring people to kind of their right medium.
Yeah, I just, you just want to make sure everyone's doing the amount that works. How does
Mhm.
being overweight or underweight affect your diabetic status?
That's a very good question. So what happens is, if you are underweight, you may not need, and again, it depends whether it's type 1 or type 2. So I want to separate both. If you're type 1 and you are naturally underweight, then nothing, everything will be fine. If you have lost weight and are now underweight, the first thing that signals is, how is your blood sugar? How has it been? Because what I have also seen, especially in certain individuals with type 1, is that they omit their insulin so that they can lose weight,
Right.
or that they can they don't have to gain weight. But then what is the unintended consequence of that behavior is that by keeping your blood sugar levels high, you are also contributing to damaging other parts of your body. So definitely it's not good. If your blood glucose levels are within target, and maybe you just wanted to decrease weight so that you can maybe decrease the amount of insulin or become less insulin resistant, then I think as long as you're healthy, then I think it's fine. Now, if you are on the other category, and let's say you may not be using insulin, and you may find that you may be more insulin resistant. So if you start engaging in physical activity and also focusing on better quality foods in the right portions, you may also find that that is going to help you as well to manage your blood sugar levels.
So let's talk about the unfortunate, gruesome aspects. So if someone's diabetes is not managed, what are the physical repercussions on the body that are sort of the result of having diabetes that's not controlled?
Yes, so I think that it is important, and that's the key part that I like that you use, and that is control. I use managed,
Managed.
um, semantics, but now in the
Yes.
diabetes world, where we have that language matters,
Yes.
we
Okay.
are shifting, certain words, and that is because many times, no matter how much, diabetes is diabetes, and there's going to be that even you're doing everything perfectly, and you may still not be controlled. So what we are doing is we're using the word manage,
Okay.
because then that means that you are going to do your part
Yeah.
as best as you can. So when your diabetes is managed, that means that you're reducing the risk of complications. And I think that that's the underscore. You're reducing the risk, and also you may be delaying the risks. Some you may not be able to eliminate completely, but you're reducing them. The most common one, heart disease, kidney involvement. The second most common reasons for dialysis besides hypertension is diabetes, that has not been managed well.
Okay.
Um, and then we also have neuropathy. For men, which is usually encourages men to take better care of themselves, is erectile dysfunction.
Mhm.
Once I say that in a class, everyone pays attention. I talk about neuropathy, heart disease, eye disease.
Yeah.
Once I say erectile dysfunction, okay, what can I do now
Yeah.
to better manage my diabetes?
And it's, can you reverse some of these conditions with better management as well once they've started?
Well, I think that the key is to have those visits with all the specialists
Mhm.
so that when it's incipient, then you can immediately try to reverse it. Yes.
That's, again, it's having people, like you say, empower people to take care of their own wellness and manage their own situation and do the best they can. I really love how earlier you said there's no blame game here. It's your pancreas is where the
Yes, that's what I
decision
tell
made,
people. I said,
the
your
individual.
pancreas failed you.
Yes.
And but at the same time, I always like to be optimistic and say your pancreas failed you. However, we have so many different medications and treatments and many things that you can do for you to be as healthy as possible. And then I encourage them to join peer support groups. And there are so many wonderful peer support groups to become inspired by people that have been living with diabetes for 50 years, for 60 years. And just to find the right treatment that works for you. I think that that's also so important to find that treatment and to find a healthcare team that understands your needs, whether you are heavily involved in sports or maybe you don't enjoy sports, but maybe you enjoy something else. It's just trying to find that that right balance that starts working for you.
I know that each treatment program is individual to each person, depending on their circumstances, and age, weight, lifestyle habits. But one thing I really want to delve into is, how does your emotional wellness play a role as a risk factor in diabetes?
Great question. Because we forget that our mind is and our brain is part of our body. So studies, and I'm going to just say studies have shown that individuals who are stressed, not just their blood pressure increases, their blood glucose level also increases. So if we, because those are the hormones that that's the fight and flight reaction that we all talk about. If you're walking and all of a sudden you see a bear, your pupils are going to dilate, you're going to start breathing heavily, your heart races. So that action releases the blood sugar levels that has been saved in your cells and say, you need all this energy now to run away from danger. But when you have chronic stress, you're basically in that mode all the time. So your blood glucose level will most likely be affected with the stress levels. I also want to share something about the importance of managing everything, not just because your mission is to bring wellness beyond just the food and the physical activity, which are components, but it's also about your mind. It's about how you feel. And one thing also is sleep.
Yeah. Oh, yeah. Yeah. Something we're all lacking
And for
sorely.
us individuals
Yes.
that
Hmm.
are over 50, sleep changes. And one of the questions that I have in my questionnaire when I see patients, I ask them not just about what are you eating? No, I ask them about what is your stress level? Anxiety. I ask them about anxiety. I ask them about depression. And I also ask them about sleep. Um, how many hours are they sleeping? Do they wake up several times? Do they have problem falling asleep again? Because lack of sleep also is tied to those hormones. And at the same time, you're going to see that with less hours of sleep, blood glucose levels tend to increase.
Right.
Hunger tends to increase. And that hunger is not satisfied by a plate of broccoli. It's satisfied by many times comfort foods that may be comforting, but they are not health inducing. So I think that those things are all combined, and it makes us as a person and our wellness or our illness beyond just blood sugar levels.
That's why I love Lorena and I were chatting a little bit offline about what we do for ourselves. And I love to walk, I love to run and weight train. And Lorena does yoga, and she keeps inspiring me to go do yoga because that relaxes the whole body. And even though that's not
Yes,
our topic today, I did want to bring it up because I think it's a wonderful enhancement to any stress reduction program.
absolutely.
Yeah.
Because physical activity, whatever it is that you find joy, and
Yes.
that's what I ask individuals, what are some of the physical activity things that you find joy? And I find tremendous joy in kayaking. It's just exhilarating. Yesterday I went bike riding just to mix things up,
Yeah.
and I read this somewhere, so it's definitely not a Lorena original, but and I posted this in social media, and I said, and it says that exercise or physical activity is the act of showing you what your body can do, not a punishment for what you ate.
Right. Perfect.
And I think that once we start shifting, because our mindset is, oh, I ate these 2 slices of bread, now I'm going to have to walk 3 miles to burn those calories. So once and I had the same mentality, but once I started focusing on what my body could do and how I can better my body, because I am not Patricia. So I may never do what you do, but I can do better compared to Lorena 2 months ago. So it's within me. It's the joy that I see. Wow, this time a month ago, I was huffing and puffing when I went up this hill. So it's to see how the changes that I'm making today, like you said at the beginning of the show, how is that going to look when Lorena is 66, 10 years from now? And then I think that that's so important because once again, I am preparing my body for my older years.
Yes.
So I started in my 50s, and what are the choices that I am making today to feel good today, but also to extend that wellness many more years.
And that's what I keep saying. It doesn't matter really how long you live, it's how well you live. It's
Yes,
quality of life on a day-to-day basis. And my motto is
yes,
bite-sized solutions. Just take a little bite out of it every day, a little more fitness, a little better nutrition, managing your stress, reaching out to friends. I love what you said about support groups because we always talk about communities of people, having other people to go to so you don't feel alone. Loneliness is the new smoking, right? Loneliness is the new sin. If
yes,
you're feeling alone in your situation, please reach out. Lorena, before we give out your information, because I know you're doing some telehealth, I want to take this opportunity to take a few minutes with the fall holidays here. Any quick tips on getting through the holidays with food? And
yes. So, so when it comes, again, I always have this little um, sayings is, if you know that there are certain foods that you cannot control because you love and adore them, nothing wrong, no judgment here, don't bring them home. That's rule number one.
okay,
If you adore ice cream, and I love ice cream, when I feel like having ice cream, I go out, I have one scoop because I feel that's enough.
right.
I savor it, and it ends. So that's one tip. The other tip is rethink what you put on your plate. And I'll give you an example. When I ask someone, Patricia, what do you feel like eating? Or what are you cooking tonight? 9 out of 10 individuals will start with the protein food first. They'll say, I'm going to make some chicken. And then after that, they think of the starch
Right.
with rice, with spaghetti, with polenta. And then maybe they think third of the vegetable. Oh, and then I'll have some broccoli, or I'll have some carrots, or a salad, right? So that's our thought process. Protein food, starchy vegetable. So I always say, rethink that. Start with what vegetable am I going to cook or vegetables, and then add the protein, and then add the starch. This way, when you're focused on what vegetable am I going to cook, that means when you're going out to eat, when you are in the supermarket shopping, you're going to start thinking of what vegetables I'm going to bring home. And if you make that the center of your plate, you have 50% of problem solved.
Right.
Then the other piece is, what fruits am I going to bring home? Not the juice, but what fruits am I going to bring home? Whether they're canned without any added sugars, or frozen or fresh, because then that's another bulk. And then the proteins that have the least amount of fat and include protein at every meal. And then your starches. I am a whole grain advocate and lover. So what are some of the things that you can bring home that you enjoy? The other thing is recipes. Try something new, something that you may not have liked in one way,
Mm-hmm.
try it in another. And then the other advice that I would definitely say is, stay away from the places where there are food if you feel that you can't manage the amounts. I always, I do like mindful eating, and that is checking in with yourself and say, am I truly hungry, or is this appetite?
Right. Right.
When am I satisfied? And allowing yourself permission that if you feel hunger, you can always go back. And then understanding what's the difference between being hungry and just having an appetite, because those are two different things. And if you have eaten enough and you're still hungry, then ask yourself, what am I hungry for? Is it thirst? Is it that I'm stressed? Is it that I need to sleep? Is it that I need to take a break from work or from other things? Because once you start thinking in that manner, you're going to tune yourself with yourself, not with external cues that it's 12 o'clock, I need to have lunch. Well, maybe not if you don't feel hungry. Or it's 11, I can't have lunch yet because it's too early. Well, maybe this is when you're hungry.
Right.
But that's a dialogue that you need to keep having with yourself. But I do believe that being exposed to foods that you may have not thought about usually make you tend to eat things that you probably never thought about. You walk into someone's office, Patricia, and they have a bowl and they have Hershey's Kisses. You never thought about having one before you entered, but now you see them,
Right.
it's like, oh my God, I need to have them. So yeah, if those things bother you, then you're probably better off not bringing them home. And when you want to eat them and move on.
An excellent suggestion, because now with the world we're in now in the pandemic, people are having holidays at home. So it used to be you go really,
Yes,
I don't know what's going to happen this fall. I think we're all a little baffled. Is that
yes,
Thanksgiving, and we're the Jewish holidays, then
yes.
Thanksgiving, then Christmas and Hanukkah and New Year's Eve, and then the Super Bowl. It all kind of folds in, but we tend to go to parties. But a lot of this we're going to be doing at home. So I think mindful eating when you're having parties at home is probably an excellent way to go right now.
Yes, yes, I agree. And another thing that I also want to add is, don't flagellate yourself
Mm-hmm.
if you feel that, wow, I went beyond the hunger because it was just good. It just
Yeah.
tasted good, and that's why I ate more. Move on.
Yeah.
That happened, move on. That doesn't define you. So you know that tomorrow I'm going to go back to my plan.
Yeah.
So I think that I want to use the since you are a professional long distance runner, one thing that I want to ask you is, when you're training and what you have reached was not done because you trained one week, it has been a continuum of your training.
Oh,
that has
yes, yes,
that led you
absolutely.
to that marathon level. So if you missed one day of your workout or 2 days, it wasn't going to make a dent
That's right.
in your overall progress.
You know, you took the words out of my mouth because I was going to also um, make that analogy with food. Is that you're in a long-term program, you know, for life. We're going to work towards making the rest of our lives healthier. So that one day um, that you felt you went to a party or you went to a restaurant, it's something that you really love and you have it. It isn't going to ruin your entire life. What's that saying? One bad day doesn't mean you have a bad life.
Correct.
That same, you know, you
Exactly.
have that day. Food is not good or bad. It's just food. It's a choice you make about it. So I'm going to be
Correct.
bad today, and I'm going to have.
Yes, it
I'm
has
going to
it
be
has
good.
no
Right.
moral
Absolutely
value.
right. I'm going to be good today, and I'm going to have an apple. Well, you can have all of the above. It's just about what you say. I love the term.
Right. An apple is neither good nor bad,
Right.
and a salad is neither good nor bad in terms of who you are. It doesn't define you. It's what you do continuously. That and we all need help because one day it's not like on Saturday I didn't feel like working out because my body wanted to just rest. So I honored my body and I rested. Yesterday, I was working out in the morning and in the afternoon. So, so when we try to get in tune with our body, it really helps. It minimizes the stress because we don't um, set these goals that are unachievable. And it says, oh, this is absolutely, absolutely fine because tomorrow I am going to have energy and I will do it again tomorrow.
Right, exactly. And each day is a new day. The sun rises, and you can make that change. And it's one of the beautiful things about getting old is that you look back and you realize you maybe have a shorter time going ahead than behind, but
Yes.
each day can be a blessing, and you can do the
Yes.
very best you each day. And if that means sleeping, if that means eating something that you want to indulge in, reading a book, moving on with your life, it's all your choice. It's all a springboard for how you want your day to be, your week, your month, etc. Yeah.
Exactly.
So Lorena, I understand that you are doing telehealth. You want to
Yes.
share that information with us, and we can put it up on the website.
Sure, sure. So I am doing telehealth, helping people to manage their diabetes again with practical information, working together with you to reach your blood glucose goals and any other health goals. And you can reach me at Lorena at Diabetes on the Web. One word, Lorena, diabetesontheweb.com. And then we can chat and we can see if if we just find common ground and help you with your goals.
Terrific. Lorena, thank you so much for joining us today.
My
And I
pleasure.
look so forward to having you back. I think there's so much more to talk about. And
Thank you
we're
so
going to get
much.
going. Have a wonderful day. And you take
Thank
care of
you.
yourself. Okay.